My name is and today we're going to be going over a talk on stress management. So today's talk will follow up on our talk from last week on the biology of stress. So as always, we'll start off with a territorial acknowledgement. So I'd just like to acknowledge with respect the Lekwungen speaking peoples on whose traditional territory the University of Victoria stands, and the Songhees, Esquimalt, and Wasanich people whose historical relationships with this land continue today. So this talk is going to be recorded, as you just heard, and it will be posted, like always, to Dr. Gair's website, which you can find the link to in the email that you got for the talk today. You can also just Google Dr. Jane Gair, and you'll find the website that way too. All right, so I'm a second-year medical student, and as such, this talk is just intended for your entertainment and education, and it's in no way meant to replace any advice from your family physician or any other healthcare professional. And all photos are either free stock photos or photos available under a Creative Commons license unless otherwise noted. And thank you for joining us again today. The agenda for today, it's pretty jam-packed. We'll start off with a recap on a little bit from the speech last week. So what is stress? Why is it important to manage our stress? And then we'll get into the different strategies for stress management. So there's physical stress management strategies that we'll go into, like aerobic exercise, nature, pet therapy, sleep, yoga, progressive muscle relaxation, and then we'll take a little 10-minute intermission, then finish off with a healthy diet and aromatherapy, and then move into the psychological stress management strategies. So writing and journaling, reappraisal, social connection, meditation and mindfulness, and cognitive behavioral therapy. And then as always, we'll have some suggested resources and time for a Q&A at the end. And just to note, I kind of arbitrarily assigned these strategies to either physical or psychological categories. That's not really any special organization. I just did that for the sake of organizing the talk. Oh, and as always, before we go to the poll here, you can put any questions or comments that might come up throughout the talk into the chat box, and I'll try to go over those on the intermission and at the end. And you can also turn your mic on in our Q&A sections. Okay, so we'll start off with a poll first, just to see which of these strategies you all have tried. And you can select as many as you'd like from this poll. So the options are exercise, going outside, pet therapy, yoga, changing how you eat, aromatherapy, writing or journaling, seeking social connection, meditation or mindfulness, and cognitive behavioral therapy. So let me just open this poll. Okay, so you can select as many as possible. You may just have to scroll down on that little box in order to see all the options. And if you haven't tried any of these strategies, that's also okay. You just don't need to click anything. I'll give about 10 more seconds here just to answer if you haven't already. Okay, so I'm going to close the poll here and I'll share the results. So it looks like the strategies that you all have tried the most is exercise, going outside, and seeking social connection. And quite a few of you still have tried how to change how you eat, some yoga, meditation, mindfulness. So quite a few strategies you all have tried, so that's great to hear. I'm going to stop sharing this here. And if it still shows up on your screen, you can just click the little X box. I just need to, oh. 1 second here, I'm just going to pause my screen sharing so I can get this out of the way. Sorry, my poll was in the way here. Okay, there we go. All right, so going back to our recap here. So what is stress? It's a feeling of emotional or physical tension, and it can be from either physiologic stressors or psychologic stressors. So today we're going to be talking about management strategies, mostly for psychological stressors. And the definition of psychological stressors is pretty broad because we're all individuals who can feel stressed by different things throughout our life. But research has shown that there are a few key elements that lead to psychological stress. And those are aptly called nuts. So things that are novel to us, things we haven't experienced, whether there's unpredictability involved, something you had no way of knowing it would occur, something that's a threat to your ego when your competence as a person is called into question, and also when you have loss of a sense of control. So if you feel you have little or no control over a situation. And the main sources of stress in our day-to-day life have been polled by Statistics Canada, and they've shown that work is the most common source of stress in our day-to-day lives, followed by financial concerns, family, and time pressures or not having enough time. And now recent events have only added to these day-to-day stressors. That being COVID-19. So shown here, the Stress in America study found that 78% of people said the pandemic is a significant source of stress in their life, and 67% said they've experienced increased stress over the course of the pandemic. And I probably don't need to tell you all what the feelings of stress include, because we've all felt it at some time or another, but the main symptoms people note feeling during times of stress are irritability or anger, fatigue or lack of motivation, feeling anxious, getting a headache, feeling depressed or sad, and having an upset stomach or indigestion. And while the effects of stress may feel negative, these systems evolve to be adaptive and beneficial to our survival in times of stress. And the short term, they are. Short-term stress can have positive impacts on our functioning, like upregulating part of our immune system and improving our performance and memory. But what about chronic stress? So chronic stress can lead to negative effects on multiple parts of the body, including widespread immunosuppression, potentially leading to increased risk for certain cancers, increasing the risk of cognitive disorders like Alzheimer's disease, can harm our cardiovascular system by increasing our blood pressure and promoting plaque buildup or atherosclerosis in our arteries. Stress can increase our risk of diabetes by increasing our blood sugar and decreasing our body's ability to regulate it. It can also increase our risk of obesity and visceral fat stores or fat around our internal organs, which can lead to other health problems down the road. It can also affect our gastrointestinal system via our gut-brain axis and contribute to conditions like IBS. It can also increase our risk of mental health conditions like anxiety and depression in the context of poor coping with our chronic stress. So with all of these potential consequences of chronic stress and poorly managed stress, we can really start to see why it's important to manage our stress as best as we can, not only to feel better in our day-to-day lives, but also improve our health down the road. So we'll start off by going through some physical stress management strategies. So for each strategy we talk about, for the rest of the talk, I'm going to start by explaining what it is, if it's something kind of new, explain the research behind it, and if applicable, give some brief tips on how to use that strategy. So we'll start off with aerobic exercise. So this is also known as cardio or endurance exercise. And it's a type of exercise that improves our cardiovascular functioning, so our heart and lungs ability to kind of function. Some examples of aerobic exercise are walking, swimming, cycling, or running. So what does the research show? So aerobic exercise has been hypothesized to protect against stress by 3 different mechanisms. One is improving our psychological coping with stress. 2 is reducing our physiological reactivity to stress, so our actual body's physical response to stress. And 3 is by counteracting the effects of stress on our disease risk. So all those kind of downstream effects that we just spoke about with chronic stress. So let's look closely at the research behind each of these suggested mechanisms. So can aerobic exercise improve our psychological coping with stress? The answer seems to be yes, most in specific populations. So several studies have reported improved mood, coping, and reduced depression and anxiety after an aerobic exercise program. However, many other studies have not been able to replicate these results. And then the most promising evidence, though, for aerobic exercise improving our psychological coping with stress is in people who already have a diagnosis of depression. So studies looking at this specific population have found that there are real beneficial psychological effects of aerobic exercise, similar to or exceeding those of medication in people with depression. And what about aerobic exercise's ability to reduce our physiologic reactivity to stress? So our physiologic reactivity to stress is the body's physical response, including things like our heart rate, blood pressure, and level of stress hormones. So for this theory, there's no real conclusive evidence. There's been a set of studies comparing well-trained exercisers, so those who exercise regularly, with those who do not exercise and are untrained. And only about half of those studies found reduced stress reactivity or enhanced recovery after stress in the people who exercise. There was another study that actually trained a group of people. So everyone kind of started at the same baseline, and they trained one group of people in aerobic exercise for 4 months. And they found that while their general fitness improved, their actual reactivity to stress did not. So next up then, can aerobic exercise counteract the effects of stress on our disease risk? So this seems to be yes. The literature seems to unanimously say, yes, it can, specifically our cardiovascular disease risk. And this would make sense since aerobic exercise strengthens our cardiovascular system. So chronic stress is thought to negatively influence a set of factors that promote cardiovascular disease, including promoting plaque buildup or atherosclerosis in our arteries, as well as increasing our bad cholesterol, decreasing our good cholesterol, and increasing our blood sugar, heart rate, and blood pressure, all of which contribute to cardiovascular disease. So almost all studies on aerobic training found a decrease in the absolute levels of heart rate, blood pressure, which reversed after detraining. So after people stopped exercising, these beneficial effects kind of went away. So this is strongly suggesting some sort of causal effect between exercise and our cardiovascular fitness. Regular exercise has also been shown to reduce our cholesterol, triglycerides, and blood sugar and diabetes risk. So aerobic exercise really should be seen as an excellent way to compensate for or prevent stress-related deterioration of our cardiovascular health. Even if the psychological makeup or the acute reactivity to stress is unchanged months after training, these benefits strongly encourage the promotion of aerobic exercise to compensate for any negative effects of daily stress on our health. So how do you engage in exercise if this is a strategy you'd like to use to help mitigate some effects of stress on your body? So I have some tips. You can try following the Canadian guidelines, which recommend about 150 minutes of aerobic exercise per week in bouts of at least 10 minutes per session. But just to note here, any exercise is better than none. So even if you don't think you'll be able to meet 150 minutes per week, try to just do as many bouts of 10 minutes of aerobic exercise as you can throughout the week. You can do this by taking a 10-minute walk at lunch, playing with your children or grandchildren, or even your pets for 10 minutes when you get home, going for a family bike ride or playing a game of tennis. And rather than meeting your friends for coffee in a coffee shop, why don't you take your coffee to go and go for a walk? Next up is nature. So there's a systematic review, which basically looks at a bunch of different studies on between nature and stress. And they found that nature exposure reduced our perceived stress in 5 out of 6 studies and reduced the physiologic stress, so our body's physical response to stress, like our heart rate, blood pressure, and stress hormones, in 7 out of 7 studies. And when compared with an urban walk, a 90-minute walk through nature was associated with decreased activity in our brain areas that are associated with stress. And finally, the result that I found the most amazing is that nature exposure of as little as 30 minutes per week was found to have the ability to prevent up to 9% of new cases of hypertension, so high blood pressure, and 7% new cases of depression. And this is because it has such beneficial effects on our blood pressure and depression that it could actually prevent new cases of these in our population. Another study that looked specifically at nature during COVID lockdowns, they found that nature exposure can reduce our stress during lockdowns, specifically through the use of public natural spaces like parks, viewing nature from home, so even just looking out your window at any trees or bushes around, and then contact with private green spaces like house plants or plants on your balcony or garden out front. All of these were associated with reduced levels of stress and psychological distress during lockdown. So some tips to improve your nature access in order to help benefit your stress levels. Try to spend at least 30 minutes per week in nature, but more is always better. Combine your exercise with nature exposure by exercising outside rather than in your house or in a gym if you can. Make use of local green spaces, so go to your local park or the woodlands or beaches nearby if accessible. And if you're not able to get outside, it looks like even just increasing your private green spaces by adding plants to your balcony or inside your home benefits as well. Next up, we're going to talk about pet therapy. So pet therapy is an umbrella term for two different types of therapy involving animals. One is animal-assisted therapy, which is when animals support people with recovery from and coping with medical conditions. There's also animal-assisted activities, which are a bit more broad. That's when animals provide any sort of general comfort and enjoyment in places like nursing homes or schools in a less structured format. So what the research shows, there was a meta-analysis, which again is a review of a bunch of other studies. They found that exposure to pet therapy can reduce our perceived stress and our physiological reactivity to stress. And they measured this by noticing significant reduction in people's self-reported anxiety and stress levels. They found a significant reduction in heart rate as well, but no effects on blood pressure. So we have another poll here. Do you think that brief exposure to dogs can reduce stress? So not just like a systematic pet therapy, but even just short exposure to dogs. So let me put poll up. Okay, so you can answer there. All right, a few more seconds here to finish up. Okay, so I'll end the poll there. Let's share the results. So yeah, 16 out of 16 of you, all of you said yes. I'll stop sharing. Okay, so yes is the answer. So brief exposure to dogs can reduce our stress. There was a study on university students that found a reduction in perceived stress and physiological stress levels after just spending 15 minutes with a dog in a really unstructured format. They found this brief exposure significantly reduced the students' anxiety scores and significantly reduced their blood pressure. And not only was there a significant reduction in anxiety scores, 85% of students who had a diagnosable anxiety disorder based on their pre-pet therapy scores showed a clinically significant change, meaning their anxiety dropped to a level low enough that it could be considered a therapeutic intervention. So tips for pet therapy, if you'd like to engage in this, try spending time with your friends or family's pets, or consider getting your own pet if that's something you've been thinking about. You could try volunteering at your local animal shelter or sign up for pet therapy. I put one local pet therapy resource in our resource sheet at the very end of the lecture. And you can either volunteer with them if you have a dog that you'd like to take to pet therapy to help other people, or I think you can look into hiring the group for your own use as well. So next up, we're going to talk about sleep. So we know that stress can negatively impact our sleep quality, but can improving our sleep quality improve our mental health? The answer seems to be yes. There was a meta-analysis of randomized control trials, which is really our highest quality of research. And it found that improving sleep leads to significant improvement in general mental health and a significant reduction in depression, anxiety, rumination, and stress. And they found a dose-response relationship with this, meaning that the greater improvements someone made in their sleep quality, the greater improvements they had in their mental health. So this really high-quality research can start to suggest that sleep is causally related to the experience of mental health issues, meaning there's a cause and effect relationship between sleep and mental health. So it's great to know that improved sleep improves our stress levels and mental health, but now you're probably wondering, how do we improve our sleep? Because that's obviously the hardest thing to do when you're stressed. So within that meta-analysis, they found a few common methods that significantly improved people's sleep quality. And the most commonly used within studies they looked at was cognitive behavioral therapy for insomnia, or CBTI, followed by acupuncture and sleep hygiene. So we'll look more closely at each of these methods now. So CBTI helps you address thoughts and behaviors that prevent good quality sleep, and it includes techniques for stress reduction, relaxation, and sleep schedule management. And all cognitive behavioral therapy, which I'll go into a bit more detail after the break, is kind of based around the principle that our different thoughts affects our behavior and emotion. And there's this feed-forward feedback relationship between all of those, in that if you're able to change your thoughts, you can hopefully change your emotions and subsequent behaviors. So randomized control trials, again, really good quality evidence, have shown that CBTI is at least effective, or at least as effective as sleep medications. And it has even greater effectiveness than medications 6 months after treatment, and might even reduce or eliminate the need for people's long-term sleep medications. And people are also significantly more satisfied with their sleep when using CBTI than when they are using medications. And these effects were found after 6 to 8 weeks of biweekly CBTI sessions. Looking next at acupuncture for improving your sleep. Again, a randomized control trial has shown that acupuncture can significantly improve people's insomnia. And they found this after 10 30-minute sessions spread out over a 2-week period. And the results from this lasted over 6 weeks after their sessions finished. And sleep hygiene. So sleep hygiene is just a general set of practices to help promote sleep. A lot of things that you might already be doing or have heard about. And I didn't look into specific research trials for sleep hygiene, but what I'm going to talk about here are recommendations made by the CDC and the Sleep Foundation. So recommendations for improving your sleep hygiene are following a consistent sleep schedule, so going to sleep and waking up at the same time, even on weekends. And it's recommended that adults get about 7 hours of sleep each night, and adults over the age of 60 are recommended to get 7 to 9 hours of sleep per night. Also, making your bedroom dark and cold. So the most optimal temperature has been shown to be 18 degrees Celsius, but anywhere between 15 to 19 degrees Celsius is recommended. And this is because it helps our natural drop in core temperature, which is kind of required in order for us to have good quality sleep. Taking a warm bath or shower before bed actually helps drop your core body temperature as well. It seems counterintuitive, but it's because this contact with really warm water dilates all our peripheral blood vessels, so the blood vessels at the surface of our body, and that allows blood to be shunted to the surface of our body to help us cool off, and that leads to the drop in core temperature. Also, avoiding large meals, especially those high in fat, right before bed, so that can lead to indigestion and other uncomfortable feelings. And avoiding caffeine and alcohol before bed. Caffeine specifically, try to avoid it 6 hours before bedtime because it stays in your body for about 6 hours. And alcohol as well can impact our REM sleep, or the how deep of a sleep we're able to get. Try to engage in some regular physical activity, and it's okay to exercise 60 to 90 minutes before bed. That shouldn't impact your sleep as long as you have that little break. And then as well, avoiding screens an hour before bed, even just putting your phone or any other screens in another room so that you're not tempted to look at them right when you're trying to fall asleep. So if you're interested in more about sleep and sleep hygiene, my classmate Alexandra did a great mini med school talk on sleep, I think last year, and that will be on Dr. Gair's website too if you didn't watch it already. So some tips here generally for improving your sleep. So work on improving your sleep hygiene and really focus on creating a routine that kind of primes your body to get sleepy with certain triggers. And if insomnia is a concern for you and you're having real difficulties with sleep, you could consider trying an alternative therapy like CBTI or acupuncture. I would just recommend talking to your healthcare provider to determine if those techniques are right for you before you engage in them. So next up, we're going to talk about yoga. And yoga is a group of physical, mental, and spiritual practices originating in India with the goal of bringing harmony between our mind and our body. So what the research has shown on just a survey of yoga users, 85% reported reduced stress when they engage in yoga. 60% said they were motivated to exercise more regularly, 40% motivated to eat healthier, and 55% reported improved sleep after engaging in yoga. And these other factors kind of confound yoga's effect on stress. So from this self-report, we don't know the actual cause of reduced stress from yoga, but it does seem like yoga is related to other health-conscious behaviors that can collectively impact our stress levels. So with that in mind, let's look at some controlled research studies on yoga and stress. So a meta-analysis of randomized control trials, again, the best research that we have on yoga in cancer patients, found that yoga may have a positive psychological effect on cancer patients. One study found that an 8-week program improved stress in cancer patients, and the effects lasted up to a year at follow-up after this program. But again, they're not able to tell if this is related to yoga as a whole or specific aspects of yoga like meditation, because yoga often encompasses quite a few different mind and body techniques. A randomized control trial on yoga in older adults, though, assigned people to either groups of chair yoga, chair exercise, or control group. And the yoga group improved more than exercise and the control groups in their anger, anxiety, depression, well-being, and self-efficacy scores. So yoga does seem to have some benefits over general exercise. So tips here, if yoga seems interesting to you, you could try attending a yoga class at your local community center if and when those open up. You could also try following along to instructional yoga videos online, or looking at flowcharts like this one online as well. So this picture here shows a progression for chair yoga that you could try following along with. There's lots of really great beginner yoga resources online if you're able to access the internet and YouTube and stuff like that. So this is our last one before the break, I think, progressive muscle relaxation. So this is a process of relaxing your muscles through a 2-step process. So first, it involves you systematically tensing different muscle groups and then releasing the tension and taking note of how your muscles feel when you're relaxed. So research has shown that a 20-minute progressive muscle relaxation session was found to significantly reduce stress in nursing students. 2 progressive muscle relaxation sessions per day for 5 days was shown to significantly reduce depression and anxiety in patients with heart disease. And 15 days of progressive muscle relaxation therapy led to significant reductions in anxiety of hospitalized cancer patients. So while these are really specific populations, it does seem to have some really promising and beneficial effects on stress and mental health. So tips for performing progressive muscle relaxation. This website I linked to here, which you'll be able to click on from the slides once they're posted, is a University of Michigan website that explains how to perform progressive muscle relaxation. And it even has this really nice chart that lists the different muscle groups and specifically how you would contract each of those groups properly. So how you would do it generally is you would either lay down or sit comfortably and just plan for about 15 minutes. It would like you to breathe in and then tense that first muscle group and hold that tension for 4 to 10 seconds. And then you'll breathe out and suddenly and completely relax that muscle group. So not gradually, just fully release that muscle. And then stay relaxed for 10 to 20 seconds, really taking notice of how your muscles feel when you're relaxed. And then you move on to the next muscle group and you repeat through the whole list of muscle groups, kind of generally from head to toe. And it takes about 15 minutes, but it's apparently quite effective. Okay, so we'll go into our 10-minute break here. And when we come back, we'll finish off with, I think, 2 last physical strategies and then cover all the psychological strategies. So you can post any questions in the chat and I'll come and look at them when we come back from our break in 10 minutes. All right, so if anyone has any questions, they could unmute right now or type something into the chat. Otherwise, we will move on to the next part of the presentation. Okay, so to bring you all back, we'll start off with a poll here. So do you think what we eat and how we eat can impact our mental health? Okay, so there's a few more seconds here. All right, I'll end the poll. And let's share the results. So 100% of you said yes. And that is the answer. So research really has shown that what we eat and how we eat impacts our mental health. Specifically, one study followed 12,400 people over 7 years of their life and found that those who increased their consumptions of fruits and vegetables during this 7 years reported higher levels of happiness, life satisfaction, and well-being. And a randomized control trial, which actually altered what people eat and controlled the other group of people, when it specifically looked at people who had depression, when they changed a group of people with depression's diet from a Western diet, which is high in processed foods, to a Mediterranean diet, which is high in fruits and vegetables, whole grains, legumes, lean meats, like these photos at the bottom here. After 12 weeks of this change on the Mediterranean diet, people's depression scores significantly decreased in the Mediterranean diet group, and a third of those were no longer depressed after this study. And a pertinent observation as well was that improvements in these depressive symptoms were independent of any weight change participants noticed. And social eating, research has shown that those who socially eat more often report feeling happier, more satisfied with their life, and more engaged in their communities. So this suggests that social eating can improve our social bonding as well as our well-being. And this is seen specifically quite often when you look at children and adolescents. There's been quite a few studies who found that regular family meals are shown to reduce the risk of mood, anxiety, and substance use disorders in children and adolescents than those who go without family meals. And this protective effect really increases with the number of shared meals that people eat per day. So for example, those who ate breakfast and dinner with their family had this increased protective effect higher than those who just ate breakfast with their family. Now, these were both observational studies, so we don't really know if increasing the social meals can decrease stress and improve well-being as an intervention, but it does show promising results. And there's definitely an association there. So tips if you'd like to kind of work on your diet in order to help manage your stress and mental health. You can try increasing the number of fruits and vegetables in your diet. Simple changes like adding a leafy green into your soups and stews because it wilts down really easily. Adding fruit to your breakfast, like mixing a banana or some apple in with your porridge or oatmeal. Try smoothies. You can put both fruits and vegetables in smoothies. Spinach is pretty easy to blend into a smoothie, doesn't really add any flavor. You could try following a Mediterranean diet as well, as much as possible, so that like I mentioned, is lots of fruits and vegetables, whole grains, legumes, fish, lean meats, and nuts and seeds. And I think there's a bunch of resources online, as well as lots of cookbooks focused around Mediterranean style eating. And if possible, I know it might be tricky in these times of COVID, but try sharing a meal with a friend or family member, or if group dining where you live opens up, really try to attend that as much as possible too. So next up here and last for physical is aromatherapy. So aromatherapy is using natural scents, often essential oils, to promote well-being. And so what the research shows is that inhaling peppermint aroma led to significantly reduced salivary cortisol levels. So that's a stress hormone. And this suggests the ability of peppermint aroma to reduce our stress levels. But interestingly, that same study found significant increase in people's salivary CGA levels, which I won't go into, but it's really just a marker of acute stress. And in other studies, they noted that when people have increased CGA levels, this is associated with a feeling of being uplifted, and it actually suggests some positive eustress or good stress being stimulated. So peppermint might kind of decrease the bad stress, increase the good stress. We don't really know, but that's what a couple studies have noted. Lavender is what I looked into because that's quite a common scent that people use for calming therapies. And there's actually mixed results in the literature. So one study showed that there was no significant change and maybe slightly increased cortisol levels after using lavender aroma. Other studies have shown decreased cortisol after deep breathing exercises using lavender aroma, but then we're unsure whether the positive results were from the breathing exercises or from the lavender or a combination. So it's really mixed. But if you'd like to start using aromatherapy, evidence shows kind of limited effectiveness for it in general, but if you're interested, there's slightly more evidence for peppermint, but again, it's personal. If you enjoy lavender and you think that helps de-stress you, then go for it. I would just recommend talking to your physician if you have a history of allergies or respiratory conditions before you go smelling various oils and scents. And try to avoid applying essential oils to your skin because they are really common irritants and can lead to dermatitis. As well, try inhaling the aroma using a diffuser rather than kind of directly sniffing it. So like this little picture in the bottom here. And then just recommendation, keep essential oils away from your pets because a lot of them are toxic if ingested. Okay, so we're going to move on to stress management strategies that I classified as psychological. So writing or journaling, reappraisal, reframing, social connection, meditation and mindfulness, and then cognitive behavioral therapy. So starting off with writing and journaling. So that just generally consists of writing about your thoughts or about a specific topic or prompt. And there's a couple different studies. One of the main types of writing or journaling that's used for mental health and physical disorders is expressive writing. And that has shown to benefit many different physical and mental disorders, things like inflammatory conditions, IBS, and depression. It's also been shown to help reduce blood pressure, increase people's self-care behaviors, and improve health-related quality of life. So it involves writing about your deepest thoughts and feelings related to emotional events. Specifically, it often involves writing about past traumas or stressors. So while those who already tend to manage their emotions through expression find benefit and reduced anxiety from expressive writing, it's actually been shown in the literature that expressive writing can increase anxiety levels in those who are less emotionally expressive normally. So this kind of suggests that matching a person's natural coping style with a similar or related strategy is really beneficial. And it also suggests that expressive writing about stressful events might be contraindicated in individuals who don't typically express their emotions that regularly. So because of this, researchers have started looking at more positive forms of writing to see if there's a similar benefit. And what they found is there does seem to be similar benefit from writing about positive things as opposed to negative. So specifically, this one study looked at writing about life goals. And it's been shown to have the same benefits as writing about trauma as we would see in expressive writing. So participants wrote for 20 minutes per day for 4 days. And 5 months after this writing exercise, both groups, the expressive writing and the life goals writing groups, had decreased illness compared to controls. And writing about life goals, however, was significantly less stressful than trauma for these participants, as you would expect. And those who wrote about life goals actually had a significant increase in their well-being scores compared to those who were in the expressive writing or control groups. So just for interest, the prompt the life goals group was given to write about was to think about your life in the future. Imagine that everything has gone as well as it possibly could. You've worked hard and succeeded at accomplishing all of your life goals. Think of this as the realization of all your life dreams. Now write about what you imagined. So that's the prompt people had that they would write about for 20 minutes a day for 4 days to find these benefits. Another type of writing that's a branch off of expressive writing is positive affect journaling. And this can kind of be thought of as expressive writing combined with positive psychology. So when they looked at this positive affect journaling and mild to moderate anxiety in individuals, they found that after people wrote for 15 minutes a day, 3 days a week, for 12 weeks in a row, they would write about things like, what are you thankful for? What did someone else do for you? Really simple, kind of positive framed prompts. This led to decreased mental distress, anxiety, and decreased perceived stress in these people with mild to moderate anxiety. And it also led to greater perceived personal resilience, greater social integration, and fewer days of these people noting pain that inhibits their activities. However, it wasn't associated with any improvements in depressive symptoms, general satisfaction with life, or other indices of social support. But nonetheless, great kind of positive results from that, especially for stress. So some tips if you'd like to try out some writing or journaling. A really similar practice to the positive affect journaling is gratitude journaling. And this has become really popular in recent days. And there's lots of resources online with different prompts and ideas if it's something you'd like to do. And the bonus of gratitude journaling is that you'll have a record of lots of different positive experiences or things in your life that you can refer back to whenever you need a reminder or a little boost in your positivity. And if you're someone who uses emotional expressivity regularly, you could consider that expressive writing kind of strategy by writing more in depth about difficult situations or stressors and your emotions involved. But just make sure you kind of express as much emotion through that as possible, because that seems to be associated with greater benefits from the exercise. So next up is reappraisal and reframing. So just some background here. Appraisal theory is that our evaluation or appraisal of events causes an emotional response based on that appraisal that we give the situation. So reappraisal then is a form of cognitive change that involves us reinterpreting an emotion-causing situation in order to alter its emotional impact on us. So this basically involves reappraising the situation to try to see it in a more positive light. And a couple ways you can do this are by imagining what advice you'd give to a friend in this situation to make them feel better, like what unexpected positive impact could this have on their life down the road? What good things might you learn from this experience? Kind of things like that that help you reframe the situation. And this picture here is a diagram of appraisal theory, and it shows how you appraise something leads to an emotional response and subsequent behaviors that you engage on based on that emotional response. So reappraisal takes time and learning, but it does help you kind of loop back into this appraisal category again, where you have the ability to make positive changes in how you respond emotionally and what actions you take based on that. So looking at the science here, a study examined whether cognitive reappraisal ability could moderate the relationship between cumulative stress and depressive symptoms. So they looked into this because they've noticed that even under really stressful circumstances, Some people don't experience elevated depressive symptoms while others do. So their theory was that how people appraise the stressful situation could determine whether they experience these depressive symptoms or not. And they found that the ability to use cognitive reappraisal to kind of down-regulate feelings of sadness was actually the best predictor of whether or not people would have depressive symptoms after a stressful event. And specifically, they noticed that at higher levels of cumulative stress, people with high cognitive reappraisal ability had fewer depressive symptoms than those with low ability to do this. But then at lower levels of stress, there was no real association between cognitive reappraisal ability and depressive symptoms. So this strategy really tends to shine at higher levels of stress and might not be super beneficial for more mild stress. Another good thing to note is that it's not only the psychological responses to stress that benefit from appraisal and reappraisal. Meta-analyses have shown that physiological stress responses can also be affected by how we appraise the situation. So optimism and positive coping have been shown to moderate the immune responses to stress, so how our immune system changes in stressful situations. And cardiovascular and neuroendocrine responses, like hormonal responses to stressful experiences, have also been shown to be dependent on someone's appraisal of the situation. And this was measured through blood pressure changes, heart rate changes, and stress hormone levels. So another poll here, we often turn to others in times of need, but does social support protect against the effects of stress? So I know it's often something that we turn to, but does it actually cause any changes in our stress? Let me open this poll up here. Okay, should be able to answer there. And just a few more seconds here to answer. All right, so I'll end the poll. Okay, so 100% of you said yes, and that's great to hear because that's also what the science says. So turning to others during times of stress can actually prevent against the effects of it. Specifically, low social support has been associated with increased morbidity and mortality, so kind of like our illness and death from multiple health conditions. And one study found that people without any social ties or good social connection were 1.9 to 3 times more likely to die from heart disease, stroke, and cancer over a 9-year study period. So the effect of social support on life expectancy appears to be as strong as the effects of obesity, cigarette smoking, high blood pressure, or physical activity on our life expectancy. Low social support has also been associated with increased physiological reactivity to stress, like increased heart rate, blood pressure, etc. For example, in laboratory studies, mental health or mental math tasks and public speaking tasks cause significantly smaller rises in heart rate, blood pressure, and stress hormone levels among people who are supported by another person than those who are doing those tasks alone. And as well, lonely people seem to have overall heightened HPA axis or stress response system activity, meaning that their stress response system is more active and therefore sending out more stress signals around the body. So what about high social support? So that's been shown to protect against mental and physical illness, and it predicts less depression in people with heart disease. And it's thought that this effect might be partly mediated by social support promoting active coping strategies, as well as more positive appraisals. It's also been shown to be an important factor in decreasing our functional impairment in patients with depression and also increasing the likelihood of recovery from depression. And it's associated as well with higher adherence to medical treatments, which, as you can imagine, would lead to better outcomes. And social connection has also been shown to enhance our resilience to stress. So overall, social support seems to positively affect our mental and our physical health, but possibly through psychosocial factors like promoting effective coping strategies and through effects on multiple different biological factors like our stress response system. So some tips here. Remember that your social support network is really there to help you, so reach out to them in times of need. Stay in touch. Take time to express how important your friends and family are to you to really keep those connections close. And I know it's easy, especially in times of stress, to not want to burden our friends and family with troubles we might be having, but they are there to help, and it's extremely beneficial to both your mental and physical health to stay connected to people, because you really don't need to go through things like that alone. And if you're looking to grow your social support network, you could try volunteering or joining a class or fitness group to meet new people. Just keep in mind that the goal of building a network is to reduce your stress and not add to it. So watch out for situations or people that might drain your energy, and really try to only add people that are going to add any positive effect to your social support network. So moving on to mindfulness and meditation. So this is generally a mental training practice that trains you to slow down your thoughts, let go of negativity, and then calm the mind and body. So looking at research, again, another really good quality study, meta-analysis of randomized control trials, found that mindfulness meditation programs can reduce symptoms of anxiety, depression, pain, and stress. However, they found no evidence that meditation is any better than other active treatments like exercise, medications, and behavioral therapies. But that being said, it still seems to have great effects if it's something that interests you more than those other types of activities. So specifically looking at mindfulness-based stress reduction programs, they've been shown to significantly improve people's symptoms of stress in cancer patients. So they've looked at 49 patients with breast cancer and 10 patients with prostate cancer that were enrolled in an 8-week program, a mindfulness-based stress reduction program, which incorporated relaxation, meditation, a little bit of yoga, and just doing this daily as a home practice. So this mindfulness-based stress reduction program participation was associated with an enhanced quality of life and a decrease in stress symptoms. It also was associated with altered cortisol, so that stress hormone, and our immune patterns, which were consistent with less stress happening at a biological level. There was also decreased mood disturbance and decreased blood pressure. And these improvements were actually maintained over a year of follow-up after the program ended. So it seems to be quite beneficial over the long term. So some tips if you'd like to try out mindfulness or meditation, you could try a self-led mindfulness meditation practice. You could do this. Generally, how to kind of lead a mindfulness meditation practice is start by setting out 5 minutes at a time. Find a quiet, comfortable place to sit and set a timer for 5 minutes. And while you're sitting there, really focus on your breathing, become aware of your breath and how your body moves as you breathe in and out. And then just simply notice your thoughts as they come. So as thoughts pop up, don't try to ignore or suppress them or say they're good or bad thoughts. Just try to be a witness to them and observe them kind of as clouds passing by. So try not to be affected by them. Just see where your mind goes and let it happen, but just don't become too attached or emotional based on those thoughts. But then be patient with yourself. If you do feel that you're getting carried away in your thoughts or can't slow your mind down, try to just, again, observe where your mind's gone without any judgment, and then focus back on your breathing to kind of recenter yourself. And as you become more comfortable with this practice, you can try longer sessions and work your way up to about 30 minutes at a time. There's also lots of really great free apps that you could get on your phone or computer that kind of lead you through different meditations. So you could look into mindfulness or meditation applications as well to help you lead you through this practice. So last up here, we have cognitive behavioral therapy. So this is a type of psychotherapy that focuses on how a person's thoughts can impact their behaviors and emotions with the goal of modifying maladaptive patterns. So CBT combines several different ways to help you change how you think. So it helps you learn to notice irrational thoughts about yourself, learn how to stop those thoughts, and also replace negative thoughts with more accurate ones about the situation. And this can help teach you to relax your mind and body and lower your stress levels. So for example, and this example is from HealthLink BC, which I've linked to here at the bottom of this slide. They said, maybe you're upset about a job review at work and your boss praised several things about your work, but you're feeling really down because you had one small criticism. And you might start thinking, I'm no good at my job. My boss doesn't like me. I must be bad. Just kind of really that negative self-spiral. But focusing on just the bad is an example of negative or disordered thinking. So you can teach yourself to watch for negative thinking and start to ask yourself how true or helpful your thoughts were. You can do this by kind of challenging what you were thinking. Remind yourself, what did my boss say exactly? Were there any positive comments that I could think about instead? Why did I only focus on this one criticism? And with time, you get faster and more effective at noticing and altering these negative thinking patterns. And eventually you'll start to naturally use more positive and adaptive patterns of thinking, which in turn will affect your emotions and behaviors and coping strategies down the road. So looking at the research on cognitive behavioral therapy, so a review of meta-analyses, which is interesting, it's actually a review of reviews on a bunch of other smaller studies. So it found that cognitive behavioral therapy is beneficial for many different physical and mental disorders. However, they found that one of the conditions with the strongest support for benefit from CBT was general stress. So that's really great for us in this talk here. And another meta-analysis specifically looking at work-based stress found CBT to be more effective than meditation or relaxation, journaling, exercise, and goal setting. And one theory to explain this that the study proposed is that CBT is more of an active process that encourages individuals to take charge of their negative thoughts, feelings, and behaviors by changing their thoughts and emotions to more adaptive ones, and by identifying and practicing more functional behavioral responses, while most of the other practices that I listed there often refocus attention away from the source of stress. So although they may be reducing our troubling thoughts or feelings, they don't actually direct you to confront the dysfunctional ideas, emotions, or behaviors like CBT does. So what about self-led CBT? Because there's lots of therapies you can sign up for with mental health professionals, but can self-led CBT improve mental health? And the answer seems to be yes, to a certain extent though. So a review of studies on self-led CBT on anxiety and depression has shown a moderate benefit on people's mental health. However, self-led therapies are not as effective as in-person or group-based interventions with a mental health professional. But that being said, self-led CBT can be helpful as a first-line practice, specifically during things like lockdowns, or if you're resource limited or don't want to seek help with a professional yet. It seems like a great way to kind of slowly ease yourself into some sort of mental health therapy, but it shouldn't replace guided clinical interventions if those are indicated or needed in your specific circumstance. So some tips for trying your own CBT practice would be becoming aware of your negative thoughts when you have them, taking a minute to ask yourself if that thought is really helpful or accurate to the situation, and then rethink. So you could also try finding a website or a book or an application that you like that could help lead you through different CBT practices. And as well, consider seeing a professional in CBT or signing up for a course if that's something that interests you. I linked to a course here. It's also in the resources at the end. So this is Be Calm, which is a local nonprofit society for many different resources and courses aimed at improving mental health for people in Victoria. And one of the courses they offer is called The Art of Living Mindfully. And it's an 8-week course focused on mindfulness and CBT-based practices. And it is generally a private pay course. However, for people with stress-related physical or mental health challenges, if you get referred by a physician to this course, MSP will actually cover the fee of the course. I think there's a small administrative fee you will still have to pay, but the general course fee gets paid by MSP with a physician referral. So definitely good to look into and talk to your doctor about if you think this would be really beneficial to your physical or mental health. And then last off, we're at the end of the talk here, but this is my personal favorite, just like really quick strategy for dealing with small daily stressors as they pop up in my life. And obviously things are never this simple, but I do find this flowchart a good reminder that, you know, your energy is best spent working on things that you have control over rather than stressing about things that you can't control and just letting those things go instead. So with that, we have the suggested resources. So I've put here the crisis line of BC. So this number here, you don't need an area code. It's 24/7 for mental health support if you'd like to talk to someone. HealthLink BC, they have a whole page on stress management with links to different strategies and different stress management explanations. There's this other website called Stress Strategies, and it's put on by the Psychology Foundation of Canada, and they have this interactive stress management tool, which I linked to over here. And this is really neat. You can actually go through and click on what the source of your stressor is, different types of strategies you might be interested in. And as you do that, it will suggest some sort of stress management strategies for you to engage in and kind of help you work towards building a plan that is personalized to your needs. Like I mentioned, there's the Pacific Animal Therapy Society, which is in Victoria, if you'd like to look into accessing pet therapy. This is that link to the University of Michigan for the progressive muscle relaxation tool. That's really helpful. And Be Calm, which I just talked about, that's a link to their Art of Living Mindfully course. And then as always, you can call 811 to speak to a nurse or dietitian, exercise professional, or pharmacist for more specific and personalized health advice. And then as always, don't be afraid to reach out to your primary care provider if you don't feel like you're able to manage your stress on your own, or would just like to talk to someone about strategies moving forward to benefit your health. Okay, so with that, I'll look at the questions in the chat here. And if anyone has questions, you can unmute if you'd like. Okay, so no questions I could see. If anyone has other questions, feel free to unmute. Otherwise, here's our top. Oh, yep.
Yeah, Maureen, can I ask a question?
Yep, you can.
Maureen, you did not emphasize or say anything about religions, praying, religious activity, going to church, temple, socialization, because through generations, mankind has always, believed into some God or some sort of belief and faith. And this has also some positive effect, on their happiness, lessening of stress and longevity.
Mm-hmm.
Yeah. So how about what is the role of these religions and religious values, spirituality, like theology, spirituality, liturgy, temples, churches, mosques, Can you throw some light on that?
Yeah, that's a really good point. So when I was looking through the literature, it did seem that religion and spirituality were quite highly associated with decreased stress levels and other benefits to mental and physical health. Mm-hmm. I didn't have time to kind of put everything in the talk, but for sure that does seem to have like actual scientific benefits to people's mental and physical health. So that's good to bring up. Mm-hmm.
No, I'm mentioning that because I come from India. Mm-hmm. And yoga, meditation, vegetarian diet, a lot of these things which are being accepted by the Western society, and it's a multi-million-dollar industry here, like Deepak Chopra. These all originated, from the old Vedic Buddhist religions. Mm-hmm. And most of the people, they practice and they lived over 100 years, So there must be some input, of these things. I mean, you don't have to believe in God. You don't have to unduly become possessed by that, but certainly it seems to have some very social, cultural, and mental benefits, you know.
Yeah, that's really true. It does seem to be kind of this like holistic and spiritual practices that really do seem to benefit lots of people as well as cultures as a whole. Yeah.
Yeah. I mean, so much so that, you know, the Columbia University, Wisconsin University, Harvard University, about 20 years ago, sent a lot of medical doctors, scientists, you know, from a Buddhist temple in Tibet, Dalai Lama. And they inserted all kinds of equipments in the minds of the monks, you know, who practice yoga, meditation, and all those things. And they came back with a very positive result. There was tremendous change in their mental chemistry, you know, brain chemistry, that they were just like cortisol was reduced, and instead a lot of other neurotransmitters were produced, which provided us happiness, reduction in anxiety, and better health. You know? So there is some medical reason for that.
Yeah, that's really interesting. Thanks for sharing. All right. So just wrapping up here. So our talk schedule coming up next, we have 2 more talks in the series. So next Sunday, we have a talk on how to avoid drug interactions. And the following Sunday, we have a talk on supplements. So we hope to see you there. Those will be put on by Drew and Julia. I'm done my talks now for this series, but hopefully we'll see you next Sunday and the Sunday after. So thank you very much, everyone. If you have any further questions or comments, you can email us at that mini med school email that you get the Zoom links from. And we'll see you next week.